Cancer Control and Prevention, brought to you by Oakland Community Health Network. This PowerPoint is part of the Oakland Community Integrated Healthcare Collaboration Project. This allows for individual organizations to determine the level of staff training needs based on position and job responsibilities, upward movement in terms of skill competency for staff, and coordinated primary care needs of people with severe mental illness or intellectual and developmental disabilities. The objectives of this PowerPoint are to teach about cancer prevention, screenings, and treatments, to identify health barriers for people with physical and/or behavioral health needs related to cancer, to promote wellness by encouraging people to live a healthy lifestyle, to see a primary care physician annually for a physical and ongoing care, to provide education about cancer resources. According to the Center for Disease Control, cancer is a term used for diseases in which abnormal cells divide without control and can invade other tissues. Cancer is not just one disease, but many diseases. There are more than 100 types of cancer. Cancer is the second leading cause of death among adults in the United States. Many things in our genes, our lifestyle, and the environment around us may increase or decrease our risk of getting cancer. In 2014, among men, Black men had the highest rate of getting cancer, followed by white, then Hispanic, then American Indian and Alaska Native, then Asian and Pacific Islander men. For more information and the graph related to this, please see cdc.gov website. Among women, white women had the highest rate of getting cancer, followed by Black, then Hispanic, then Asian Pacific Islander, then American Indian, Alaska Native women. The year 2014 is the most recent year for which numbers have been reported for these statistics. According to survey results, Michigan Department of Health and Human Services noted people with physical and/or behavior health needs are the state of Michigan's largest minority group at about 25.5% of Michigan adults. People with physical and/or behavior health needs is defined as being limited in any activity because of physical, mental, or emotional problems, or requiring the use of special equipment such as a cane, a wheelchair, a special bed, or a special telephone due to a health problem. People with physical and behavioral health needs are significantly more likely to have other chronic conditions, including arthritis, diabetes, cardiovascular disease, depression, and cancer. According to Michigan Behavioral Risk Factor surveys conducted, 20% of people with physical and/or behavioral health needs reported having ever had cancer, compared to 9.2% among people without the same needs. People with a disability in Michigan had higher rates of health risk factors, including obesity, smoking, inadequate physical activity, and fruit consumption, relative to persons without a disability. The Michigan Health Promotion for People with Disabilities Initiative is a statewide partnership committed to reducing the health disparities between people with disabilities and people without disabilities through member collaboration, expertise, and leverage resources. The Center for Disease Control studies concerning people with physical and/or behavior health challenges have shown they are more likely than people without the same challenges to report poorer overall health, less access to adequate health care, and smoking and physical inactivity. People with physical and/or behavior health challenges also have a need for quality health care and programs to stay well, active, and a part of the community. In 2013, about 1 in 5 adults in the United States had a physical and/or behavior health disability. People with physical and/or behavior health needs have trouble getting health care for many reasons, including cost, challenges scheduling appointments, and transportation. People with physical and or behavioral health needs typically have lower cancer screening rates, making it more likely that their cancer is found later. Other barriers faced by people with physical and behavioral health needs are wait time, limited physical access to facilities or equipment, and inaccessible health communication formats such as Braille, American Sign Language, and large print. A person's disability is often the primary focus of medical encounters, overshadowing basic primary care services such as preventive tests and screenings, guidance on diet and exercise, and tobacco cessation counseling. The Center for Disease Control is working to identify, reduce, and prevent disparity in key health indicators. Cancer control and prevention. The Center for Disease Control has a national comprehensive cancer control program to reduce the burden of cancer in the United States. This program helps fund all United States and territories to create coalitions, evaluate the cancer burden in their area, prioritize proven strategies for cancer control, and create and implement cancer plans. The Michigan Cancer Consortium is funded by the CDC and has developed a 5-year plan for cancer control and prevention, which is posted on its website at michigancancer.org. The MCC website provides various resources, including community partner organizations, educational website links, and end-of-life resources. The Michigan Department of Health and Human Services website contains educational resources and statistics related to types of cancer and mortality. For Michigan cancer incidence and mortality in 2015, please see this link below. The risk for developing cancer can be greatly reduced by living a healthy lifestyle, diet and exercise, getting vaccines, and completing doctor-recommended screenings. Research also shows that cancer can be prevented by treating precancerous lesions found by screenings. The next several slides will review lifestyle choices to prevent cancer. Some of the healthy living choices for cancer prevention include establishing a primary care doctor for annual physicals, avoiding tobacco and limiting alcohol consumption, choosing a healthy diet, protecting skin, checking homes for radon gas. And for further information, the National Cancer Institute is at cancer.gov on the internet. A primary care physician can decrease cancer risk due to early detection of health conditions, promoting prevention and referral to specialists. Follow through with physician recommendations for exercise, diet, tests, and health screenings to lower cancer and other health risks. Complete lab work, blood work, and urinalysis for physicians to evaluate. Ask questions and discuss concerns. Avoid tobacco. According to the CDC, smoking causes many types of cancer and about 80 to 90% of lung cancer deaths. Lung cancer is the leading cause of cancer death. Smoking causes 9 out of 10 lung cancers and can also block the body from fighting diseases. Quitting smoking lowers the risk for cancers of the lung, mouth, throat, esophagus, and larynx. Poisons in cigarette smoke can weaken the body's immune system, making it harder to kill cancer cells. Poisons in tobacco smoke can damage or change a cell's DNA, and the DNA is a cell's instruction manual that controls a cell's normal cell growth and function. When DNA is damaged, a cell can begin growing out of control and create a cancer tumor. Secondhand smoke is responsible for the death of 7,300 non-smokers in the United States every year. E-cigarettes or vapes are not a safe alternative due to nicotine and other toxic cancer-causing chemicals in the e-liquid and aerosol. According to the CDC, tobacco smoke contains a toxic mix of more than 7,000 chemicals and many are poisons. At least 70 are known to cause cancer in people or animals. People who smoke cigarettes are 15 to 30 times more likely to get lung cancer or die from lung cancer than people who do not smoke. Quitting smoking at any age can lower the risk of lung cancer. If you are a smoker, keep trying to quit to reduce your risk of developing cancer. Remember this too, smoking makes asthma and pneumonia worse, and smoking can lead to a lung disease called COPD, which is nearly as bad as lung cancer. COPD, which is chronic obstructive pulmonary disease, includes emphysema, chronic bronchitis, and in some cases asthma. There is no cure for COPD, but there is treatment to help with breathing. Quitting smoking can prevent the damage from getting worse and improves the prognosis for people with cancer. Some of the resources for helping people quit smoking is Michigan Department of Health and Human Resources on their website, Michigan Tobacco Quit Line, the American Cancer Society, and the Quit Smoking Monday campaign at iQuitMonday.org. Alcohol is a carcinogen, meaning something that causes cancer. Drinking any kind of alcohol can contribute to cancers of the mouth and throat, esophagus, colon, liver, and breast. Reducing alcohol use will lower the risk of cancer. Alcohol can act as an irritant to the tissues in our body. Is beer or wine safer to drink than liquor? Neither is safe. One 12-ounce beer has about the same amount of alcohol as a 1 5-ounce glass of wine or a 1.5-ounce shot of liquor. It is the amount of alcohol consumed that affects the person the most, not the type of alcoholic drink. The risk of cancer is much higher for those who drink alcohol and use tobacco. The federal government's dietary guidelines for Americans defines moderate alcohol drinking as up to 1 drink per day for women and up to 2 drinks per day for men. It has been suggested that certain substances in red wine, such as resveratrol, have anti-cancer properties. However, there is no evidence that drinking red wine reduces the risk of cancer. Keep a healthy weight through diet and exercise. Being overweight substantially raises a person's risk of getting endometrial, breast, prostate, and colorectal cancers. Overweight is defined as a body mass index of 25 to 29. Obesity is defined as a body mass index of 30 or higher. Body mass index is used to determine a person's weight in relation to their height. There are ranges for underweight, normal weight, overweight, and obese. The CDC has more information on diet and exercise as well as many other resources. Please ask a physician what is right for you. Choosing to eat a healthy diet and exercising regularly will reduce the risk of developing cancer. Protect the skin. Avoid ultraviolet, which are UV rays from the sun and tanning beds. Seek shade. Apply sunscreen with SPF of 15 or higher and wear sun protective clothing, a hat, and sunglasses. Indoor tanning exposes users to 2 types of UV rays, UVA and UVB, which damage the skin and can lead to skin cancer. Every time a person tans, they increase their risk of getting skin cancer, including melanoma. Indoor tanning also causes premature skin aging like wrinkles and age spots, changes in the skin texture, and increases the risk of potentially blinding eye diseases if eye protection is not used. What is radon? It is a natural occurring radioactive gas without odor, taste, or color. It is a result from the breakdown of uranium in rocks and soil. It can seep into homes and buildings through cracks in floors and walls or gaps around service pipes. People are exposed by breathing radon in the air indoors, especially in basements. The concentration outside is not likely to be dangerous. Radon is estimated to be the second leading cause of lung cancer in the United States, the leading cause among non-smokers. Radon test kits are available through Oakland County at oakgov.com or by calling the North Oakland Health Center. In January, they are half price at around $5. Professional radon testing companies are available on the EPA website also. According to the Dietary Guidelines for Americans 2015 through 2020, a healthy eating plan includes emphasis on fruits and vegetables, whole grains, and fat-free or low-fat milk and milk products. It includes lean meats, poultry, fish, beans, eggs, and nuts. And it's low in saturated fats, trans fats, cholesterol, salt, and added sugars. A May 2016 study in the Journal of American Medical Association Internal Medicine from researchers at the American Cancer Society and the National Cancer Institute links exercise with a lower risk of 13 specific types of cancer. The study found that leisure time physical fitness was associated with a significantly decreased risk of not only colon, breast, and endometrial cancers, but also esophageal cancer, liver cancer, stomach cancer, kidney cancer, and myeloid leukemia. In addition, physical activity was strongly associated with a decreased risk of multiple myeloma, a blood cancer, as well as cancers of the head and neck, rectum, bladder, and lung in current and former smokers. How often and how long is it recommended to exercise for cancer prevention? About 150 minutes of moderate intensity exercise a week is recommended. Remember, some physical activity is better than none, and adults who participate in any amount of physical activity gain some health benefits. Which vaccines can reduce the risk of developing cancer? The human papillomavirus vaccine is approved by the FDA and is recommended by the CDC for both males and females as a preventative cancer measure. It is routinely given at 11 or 12 years of age, but it may be given beginning at age 9 through age 26. It is usually a two-shot series, 6 to 12 months apart. A healthcare provider evaluates individual needs. The human papillomavirus is the greatest risk for cervical cancer. HPV is the virus that is spread during sex. In the United States, about 12,000 women get cervical cancer every year, and about 4,000 women die from it. In Michigan in 2017, there will be about 370 new diagnoses of cervical cancer and about 110 deaths. If anyone would be interested in reading an article on the pros and cons of the HPV vaccination, there's a web link on this slide at the bottom. Worldwide, common risk factors for liver cancer is chronic hepatitis B virus or hepatitis C virus. Most people do not know they carry the hepatitis B or C virus, and more than 4 million people are living with them in the United States. The vaccine for hepatitis B includes a series of 3 injections within a 6-month period. This is recommended for all age groups. The hepatitis A virus is not related to chronic infections, but there is a vaccine available. Hepatitis B is a liver disease caused by the hepatitis B virus, HBV, and is transmitted when blood, semen, or another body fluid from a person infected with the hepatitis B virus enters the body of someone who is not infected. This can happen through sexual contact, sharing needles, syringes, or other drug injection equipment, or from mother to baby at birth. Hepatitis B ranges in severity from a mild illness lasting a few weeks, which is acute, or to a serious long-term chronic illness that can lead to liver disease or liver cancer. Some of the symptoms may be abdominal pain or dark-colored urine, and people might not have any symptoms. Hepatitis C is a blood-borne virus. Most people become infected with the hepatitis C virus by sharing needles or other equipment to inject drugs. There is not a vaccine to prevent hepatitis C virus. Most persons with chronic HCV infection are asymptomatic. However, many have chronic liver disease, ranging from mild to severe, including cirrhosis and liver cancer. The CDC recommends testing for HCV for anyone who was born between 1945 and 1965 or received blood or organs before 1992. If anyone is currently using IV drugs or has in the past, it's best to be tested. If they've received clotting factor concentrates before 1987 or received long-term hemodialysis. Anyone who has had an HIV infection should be tested, and children born to women positive for HCV should be tested. Treatment of chronic HCV infection can eliminate the virus in many people, and preventing hepatitis C and B infection in people who have not been immunized is based on understanding how they develop. These viruses can spread through sharing contaminated needles, such as in drug use, unprotected sex, through childbirth, and contact to blood and body fluids. It is important to see a doctor experienced in treating hepatitis C because treatment depends on many different factors. Several types of treatment are available, and treatment of chronic HCV infection can eliminate the virus in many people. In approximately 25% of people, an acute infection may clear on its own. HCV is not spread by sneezing, hugging, holding hands, coughing, sharing eating utensils or drinking glasses, or through food or water. HCV is transmitted by injection drug use, receipt of blood, blood products and organs before 1992 in the United States, needle stick injuries to healthcare workers, birth to a HCV-infected mother, sex, and sharing items with infected blood. The next several slides will describe cancer screenings recommended for breast, cervical, colon, and lung cancers. A screening means checking the body before there are symptoms. Regular screening tests may find breast, cervical, and colorectal cancers early when treatment is likely to work best. When abnormal tissue or cancer is found early, it may be easier to treat, and it is important to know what screening tests can have potential harms as well as benefits. Where can people go to be screened, and what about the cost? Primary care doctors refer people to specialists in testing facilities, and most insurance plans covered recommended screenings. For Medicare, they can call 1-800-622-4227, or the National Cancer Institute can be called for questions at 1-800-422-6237. And for Michigan residents, there's free screening resources at the link noted on this slide. And the CDC has a website at the bottom of this slide. They also offer national breast and cervical cancer early detection programs for free or low-cost mammograms and Pap tests nationwide. The CDC supports screening for breast, cervical, colorectal, and lung cancers as recommended by the United States Preventive Services Task Force, and their link is noted there on the slide. The United States Preventive Services Task Force is made up of doctors and disease experts who review research on the best ways to prevent diseases and make recommendations on how doctors can help patients avoid diseases or find them early. Please check the CDC for updates or changes which may take place in the future. This information here was available in October of 2017. The next several slides will review breast cancer screening. Mammograms are the best way to find breast cancer early, when it is easier to treat and before it is big enough to feel or cause symptoms. In the United States, digital mammography has replaced conventional or film mammography, and the procedure is the same, and they can be easily enlarged or enhanced and shared electronically. A mammogram is an X-ray picture of the breast, and regular mammograms are the best tests doctors have to find breast cancer early, sometimes up to 3 years before it can be felt. Mammograms are used in comparison to previous ones taken for any noted changes. An abnormal mammogram does not always mean that there is cancer. Further testing and/or referral to a specialist may take place. Although many women are offered 3D digital breast tomosynthesis, it has not been determined if it is superior to 2D mammography at identifying early cancers or avoiding false positive results. MRI is used along with mammograms to screen women who are at a higher risk for getting breast cancer. The United States Preventive Services Task Force recommends that women who are 50 to 74 years old and are at average risk for breast cancer get a mammogram every 2 years. Women 40 to 49 years old should talk to their doctor or other healthcare professional about when to start and how often to get a mammogram. There are several other leading organizations with breast cancer screening guidelines as noted on this chart link from the CDC website. Some women carry certain genetic changes in their breast cancer susceptibility genes that increases their risk for getting breast, ovarian, and other kinds of cancers at a young age. There are two BRCA genes, BRCA1 and BRCA2. Normally, these genes help protect women from getting cancer, but when changes or mutations take place on one or both BRCA genes, cells are more likely to divide and change rapidly, which can lead to cancer. Women who know they have inherited a harmful BRCA1 or 2 mutation can take steps to reduce their risk of breast and ovarian cancer. However, any preventive measures, including use of chemo prevention and prophylactic surgery, come with their own risk. See this link for breast cancer risk information. Women should see their physician to discuss concerns and determine if genetic testing and treatment is recommended. For information on other genes that can play a role in hereditary cancer syndromes, see this link, Genetic Testing for Hereditary Cancer Syndromes. Pap tests can find abnormal cells in the cervix, which may turn into cancer. They can find cervical cancer early, which increases the chance of being cured. They are recommended every 3 years for women between the ages of 21 and 65 years old and can be done in a doctor's office or a clinic. The HPV test looks for the virus, the human papillomavirus, that can cause these cell changes. This is usually completed along with a Pap test. A woman who has had a total hysterectomy for reasons not related to cervical cancer and with no history of cervical cancer or serious precancer should not be tested. All women who have been vaccinated against HPV should still follow the screening recommendations for their age groups. Some women, because of their health history, may need a different screening schedule for cervical cancer. The next few slides will describe colon cancer screenings and tests. Colorectal cancer almost always develops from precancerous polyps, which are abnormal growths in the colon or rectum. Screening tests can find precancerous polyps so they can be removed before they turn into cancer. The United States Preventive Services Task Force recommends adults between the ages of 50 to 75 be screened for colorectal cancer, and ages 76 to 85 should ask their doctor if they should be screened. For the vast majority of adults, the most important risk factor for colorectal cancer is older age. Most cases of colorectal cancer occur among adults older than 50 years of age. The median age at diagnosis is 68. Here are some tests that find polyps and cancer, and they're recommended to start at age 50 for both men and women. Colonoscopy is recommended every 10 years, and this is an outpatient procedure where the doctor can look at the inside of the large intestine, which is the colon and the rectum, and it's examined with a small camera. A CT colonography, this is recommended every 5 years, and this is a CT scanner and it produces detailed pictures of the colon and rectum. The next test is a flexible sigmoidoscopy, which is recommended every 5 years. This is a flexible lighted tube called a sigmoid scope, and it checks the lower colon for polyps and cancer, and the doctor cannot check the upper part of the colon with this test. Next is a double contrast barium enema every 5 years, and this is an X-ray examination of the colon and rectum. The barium enema helps outline the colon and rectum, which stands out in the X-rays, and doctors use this test to screen people who cannot have a colonoscopy. Some non-invasive tests that can be done to detect blood in the stool, which may be a sign of polyps or cancer, include the FIT test, which is a yearly fecal immunochemical test, and also the GFOBT test, yearly GUIAC-based fecal occult blood test. There's also a stool DNA test, which is completed every 1 to 3 years as recommended by a healthcare provider. It's just important to be tested no matter which test is recommended or completed. And if any of these tests are positive, a colonoscopy should be completed. Lung cancer screening. The United States Preventive Services Task Force recommends yearly lung cancer screenings with low-dose computed tomography for people who have a history of heavy smoking, smoke now or have quit within the past 15 years, and are between the ages of 55 and 80 years old. See a dentist at least annually for oral, head, and neck cancer screening. If anything unusual is found, a biopsy and/or a referral to a specialist will take place for further evaluation. Tobacco use, heavy alcohol use, and infection with the human papillomavirus increases the risk of head and neck cancer. The HPV vaccination may help prevent oral HPV infection and cancer. Screenings for ovarian, prostate, and skin cancers have not been shown to reduce deaths from those cancers. People should show their doctor any new growths or skin changes, including sores that do not heal, growths that change or look different from other moles, such as size, irregular border, and color. For endometrial or ovarian cancer, for possible symptoms, women should report any unexpected vaginal bleeding, bloating, or abdominal pain to their doctors. In regard to skin screenings, the American Academy of Dermatology Association differs in opinion from the United States Preventive Services Task Force and recommend that people regularly examine their skin for signs of skin cancer and see a board-certified dermatologist if they notice any unusual spots on their skin, including anything changing, itching, or bleeding. Those with an increased risk of melanoma or a history of skin cancer should consult a dermatologist. Please see the link below for further information. Starting at age 50, men should talk to a healthcare provider about the pros and cons of testing for prostate cancer. A prostate-specific antigen test may find prostate cancer at an earlier stage than if you don't get screened, but most medical groups don't recommend screening with a PSA test. Research has not proven that the potential benefits of testing outweigh the harms of testing and treatment. Most men with prostate cancer are older than 65 years and do not die from the disease. There are many different types of treatment for cancer, including surgery, radiation, chemotherapy, biological or hormonal therapy, and some alternative treatments. Treatment depends on the type of cancer and the stage of the disease, meaning how severe the cancer is and if it has spread. Oncologists, cancer physician specialists, can provide education on treatment options. Most treatment plans include surgery, radiation therapy, or chemotherapy. Other plans involve biological therapy or hormonal therapy. Some cancers respond best to a single type of treatment, and other cancers respond best to a combination of treatments. The goal is to eliminate the cancer, however, sometimes it is to control the disease process or to reduce symptoms. Surgery for cancer involves an operation where doctors remove the tissue with the cancer. Chemotherapy involves special medicines to shrink or kill cancer cells. The drugs can be pills, injectables, or both. Hormonal therapy blocks cancer cells from getting hormones. Biological therapy works with the body's immune system to fight cancer cells or control side effects from other treatments. Radiation therapy uses high-energy rays, like X-rays, to kill cancer cells. Stem cell transplant is a bone marrow transplant recommended for patients who receive high doses of chemotherapy or radiation. High-dose therapies destroy both cancer cells and normal blood cells. Stem cells help the body to make healthy blood cells, replacing ones lost due to cancer treatment. This treatment is a complicated procedure with many side effects and risks. Choosing the treatment that is best can be difficult. A cancer doctor can explain treatment options available for different types and stage of cancer. Getting a second opinion may help. Cancer patients and survivors may experience anxiety, depression, and fear. It is normal to have a fear regarding a cancer diagnosis. Psychologists, social workers, and patient navigators help people find appropriate and affordable mental health and social support services in both hospital and community settings. Michigan Cancer Consortium offers resources for medications, financial and legal concerns, and support groups. Support meetings and locations can be identified by contacting the American Cancer Society. For crisis support, feel free to contact the Resource and Crisis Line of Oakland County, 1-800-231-1127, and Suicide Prevention Lifeline number 1-800-273-TALK, that's 8255. This office can help and will provide the number for a local crisis center. Here are some IPAS goal examples. For medical behavioral management and healthy behaviors, individual will follow the doctor-approved recommended diet, will attend medical appointments, will take medications as prescribed, will report any side effects of medication to the doctor. For modifying behaviors, individual will learn how to use home medical equipment. And for healthy coping skills, emotional management, individual will ask questions about their disease and seek out resources, and they will seek emotional support if needed from a doctor, case manager, therapist, friends, or family. Some cancer resources: Centers for Disease Control and Prevention, American Cancer Society, Michigan Cancer Consortium, World Cancer Research Fund International, the Michigan Department of Health and Human Services, the American Society of Clinical Oncology, the National Cancer Institute, Oakland County Chronic Health Condition Statistics Link. The Michigan Cancer Research Consortium, NCORP, and NCORP stands for National Cancer Institute Clinical Research Program, is a comprehensive clinical trial program that consists of medical centers that have met the highest standards of excellence in conducting cancer clinical trials. The Michigan Cancer Research Consortium is one of only 34 community-based research programs conducted and supported by the National Cancer Institute. St. Joseph Mercy Oakland Hospital is one of the hospitals in Michigan included in this research group. This group, their mission is to increase access for all patients to the state-of-the-art cancer treatment, and they achieve this by linking patients in their communities with leading clinical cooperative groups and large cancer treatment centers located throughout the United States and Canada. Here are some free phone resources. One is called Living With. This is created by Pfizer for cancer resources, connection to others with cancer, and support. And then there's Quitter's Circle. This is created by the American Lung Cancer Society and Pfizer for people who want to quit smoking and their supporters. Cancer quiz. Number 1. Cancer doesn't spread to other parts of the body. True or false? Number 2. One treatment for cancer is chemotherapy. True or false? Number 3. Using sunscreen of SPF 15 or more helps prevent skin cancer. True or false? Number 4. Tobacco use can cause lung cancer. True or false? Number 5. A colonoscopy is recommended at age 50 as a screening for breast cancer. True or false? Cancer quiz answers. Number 1, cancer doesn't spread to other parts of the body. This is false because it does spread to other parts. Number 2, one treatment for cancer is chemotherapy. This is true. Number 3, using sunscreen of SPF 15 or more helps prevent skin cancer. This is true. Number 4, tobacco use can cause lung cancer. This is true. Number 5, a colonoscopy is recommended at age 50 as a screening for breast cancer. This is false. It's for colon cancer. MyStrength, the health club for your mind. MyStrength offers web and mobile self-help resources empowering individuals to be active participants in their journey to becoming and staying mentally and physically healthy. The website's noted on the bottom of the slide, and please encourage the individuals we serve to use this website, and anyone that works with us is welcome to use this website. This concludes the presentation. If you have any questions or concerns, please feel free to contact Susan or Nicole at the following email addresses or phone numbers. Thank you for watching.